For those of you, many of you have met us at our speed dating and other hallway conversations, but if you're not aware of WD Partners, we are a firm that really deals with the design and execution of a variety of environments. We actually are very well known in the retail space, and that's why we really have a distinctive consumer bent to everything that we do. But I lead the health and wellness practice, and overall, our services are quite broad, going from all the way from insights and strategy through digital and environmental design. We have a team of industrial engineers that look at the operations and workflow of your environments, and then a fully integrated architecture and engineering practice of all forms of engineering, all in-house, and then also construction solutions. So everything from the inception of an idea through to the cutting of the ribbons. So, and we actually execute all over the country and actually are international as well. So we can go wherever you are. But today, we're going to talk about your industry. You are all here because you are in healthcare. But what's really interesting about the term healthcare is that the first part of that, health, is being redefined as we speak. And many of you are participants in that because you are consumers too. You don't just work, you are also the people that are living day to day. But let's face it, what we've been doing for a long time is what we really are referring to as reactive healthcare. It's reactive health. I have a problem. I have symptoms that I need to be expressing. And then I come in and I get treatment. It's fix me health is what I call it. Fix me health. And that's been the way that we've been really understanding the healthcare environment for many, many years. But now the question is, when does the care part click in? And the care really begins, and consumers don't really seek out care. 65% of consumers don't seek out care until it gets urgent. And that's a problem. And so what we're really starting to see with consumers is a movement toward proactive care. Don't wait until you need something. It's time to prevent your illnesses or the symptoms that might arise. It means access to the latest information for them. They're gathering all this information, and we'll be talking a little bit about that. They want to stay healthy, and they want to really live a life of wellness, not the kind that's like CBD and dispensary kind of wellness that you get a lot of different terminology around that, but really truly well-being and wellness. And this is not an insignificant segment. Almost half of consumers say that they are proactive in the way that they view their health. So this is a very significant part of our population. Only 29% would consider themselves reactive in terms of the way that they address health. And according to McKinsey, 82% of consumers now consider wellness a top priority in their everyday lives. And almost 60% of consumers are prioritizing wellness now more than ever before. So this is an important thing for them to realize, and it's definitely a movement that's afoot among consumers. It's really captured in this quote from KPMG that says, consumers are taking a more proactive and discerning approach to their health choices. The health and wellness economy is the largest part of the healthcare market, exceeding sick care, and is driven predominantly by consumer decisions. So this is an important movement that is occurring. So what does it look like? What does proactive health actually look like? Well, it starts with information. There's a lot of sources of information, as we've been talking about at this conference. But I think there's a real shift too in the trust and where you see that information coming from. And I have a good friend who runs an agency called Parallel Path, and he summed it up in one of his blogs. It says, once upon a time, we believed in people in lab coats. Now, we believe stay-at-home moms with ring lights. The biggest voices in health and wellness aren't doctors or dietitians anymore. They're influencers with a sturdy tripod, compelling before and after, and audiences that listen. And this is really an important thing, that we're now looking to different types of people for that expertise. And they're not just looking at these double-blind studies. They're interested in what has worked. What did you experience? That story that was told this morning about an actual cancer incident, that is meaningful to us. And that means something in terms of, if they have a success story, then how can we replicate that? Trust goes well beyond these experts. And so academic training, when they asked in a study, 67% said that they consider personal experience with health issues as a legitimate health expert. 64% said if it benefited me in the past with their advice. So they're looking for evidence coming from people who have experienced it. And this is very different. And when we speak about trust too, trust in the healthcare system, according to a recent study, is that trust in the healthcare system went from 71% in 2020 to 40% in 2024. So that trust is coming from the healthcare environment. Another aspect of proactive health is testing. And consumers, you can see a large amount of interest here in various ways of doing proactive testing on how my baseline health, if you will, genetic testing, blood work, preventative MRIs. You see significant amount of interest, but you also see that there's an enormous amount of interest, and I'm willing to pay for it, not just with my insurance dollars, but out of pocket. So this is very, very interesting development that I care so much about my health that I'm going to do a baseline test to see where I am right now and then monitor where I'm going. And so other companies are starting to jump into this. Function Health just bought Ezra, and they are offering a $499 annual subscription to be able to do 160 different blood tests and then track your results over time. And they're even doing a full body scan that takes 22 minutes and costs another $400. They have a 200,000 person wait list for this service. And others are hopping in. You see the money is flowing into the testing space, with Nico Health getting $260 million and others getting a significant amount of money. And there's even a group called Mindspan that has a comprehensive brain health report. So they're doing testing even on your brain. This is all preventative. This is all to see where you are today. This isn't part of a medical treatment that is treating any symptoms. Along with testing then comes the continuous monitoring of, okay, now that I know where my baseline is, how do I monitor how I'm progressing along that baseline? And we all are familiar with wearables, but we've actually coined a term in our work that we call healthables. This is different than just wearables. We were all familiar with the watches and the Aura rings and other ways of being able to track continuously your health metrics. But there's also different kinds of, if you will, healthables, and those would be ingestibles, smart pills that can see where you're going with your health metrics, as well as embeddables, things that are actually injected into your body to be able to track your various movements and what you're doing. This continuous monitoring allows us to have ongoing vitals being monitored so that we can continuously see where we are and be able to gauge like what kinds of activities are leading to what kinds of results. It includes nutrition, sleep, fitness, etc., as well as medication adherence and even mental health and well-being. So we're really able to see this on an ongoing basis. And that means that we're able to get to a higher level of personalization. So now we have all this information, and you combine it with AI, and now along with the genomics and testing information that we talked about earlier that forms the baseline, you have this continuous information that's coming in. Now AI can provide a whole group of evidence-based information and start to detect subtle changes that can actually prevent disease or prevent things or see what's happening before they manifest into a problem for you. So this is really powerful in the future. And this is something that, for instance, the chief scientific officer of Thorne says, the real transformation will come when healthcare prioritizes prevention, intervening at the biological level before symptoms ever arise. The center of healthcare delivery will move from the clinic to the home, with AI enabling remote monitoring and personalized guidance. Thought that really summarized the power of what we're looking at with this whole movement. But another aspect of proactive health is lifestyle. The CDC reports that 80% of heart disease, stroke, and type 2 diabetes cases can be prevented with lifestyle changes. So some of those lifestyle changes include what you eat. Food is medicine is a huge movement. My colleagues and I just got back from a huge food is medicine conference. It's a well attended, and many different types of people are getting involved with this movement. Your grocers are starting to take food as medicine very, very seriously, because 60% of adults are affected by chronic disease in this country. And poor diet overall is the leading cause of mortality in the US, more than 500,000 deaths a year. And there, you're starting to see a lot of different ways in which food as medicine is starting to become known to people, including a lot more evidence around the gut, a lot more evidence about microbiome. And a lot more attention is going to be placed on nutrition as we look at this new administration, certainly, as they put a priority on what you eat and even regulating that to a larger degree. Interestingly, as far as food as medicine, it's been identified that 10 foods, whether you eat too much or too little of these foods, can cause nearly half of all US deaths from heart disease, stroke, and type 2 diabetes. So it has a lot of opportunity to prevent a lot of illness if we treat food as medicine properly. But another aspect of lifestyle is a new movement that's called sober curious. Now that's not amongst you guys. I see from last night. Definitely, that's not the condition here. But a lot of younger people, actually 70% of consumers, believe that reducing alcohol consumption will positively affect their health and their productivity, as well as the low and no alcohol movement is really starting to have an amazing growth pattern, and with actually the no alcohol products leading growth even amongst the low alcohol products. So it's it's definitely coming about. You're seeing a lot more products on the shelves. I was interested to see even at our happy hours, we had no alcohol options with athletic beers and so forth. So very interesting movement that is taking place, and many young people are very into the sober curious movement. But another aspect of lifestyle is fitness, getting more active, getting more involved. And so activity and fitness has increased 5.3% since 2017. And in 2023, almost 80% of Americans participated in at least one physical activity, and that was a growth rate from the previous year. Young people are starting to see fitness as actually an identity, something that they really say, this is part of my identity, not just a hobby, not just something I'm doing, but it's actually what I stand for. And fitness club memberships are going through the roof, increasing 20% annually from 2019. And along with that fitness, we're starting to see this entire movement toward healthy aging, or what is being termed in the industry longevity. A lot more science around longevity because they're recognizing that the opportunity is there with the 60 and over population doubling to 2.1 billion people by 2050, according to the WHO. And there's new breakthroughs also in the study of aging. So you're starting to see some new treatment types, some new ways in which we're identifying what differentiates those people that live longer and those people that do not live long. And that's really leading to some new and alternative treatments. And many people are starting to look at this whole movement of biohacking, trying to figure out how they can change their lifestyle, change the way that they do their daily patterns to optimize their ability to prolong their life and prolong it not just in years, but in health. And so there's a whole new terminology away from chronological age to what we call biological age. And that's like, what do I actually feel like? Not how old I am, but how old do I feel? And how old is my health pattern? And we're also changing the whole definition of lifespan to now health span. It doesn't matter how long I live, if the last 20 years of my life are in a hospital bed, right? So what is my health span? What is the span of my life that is healthy? And that is a whole way of which people are starting to think differently. So these new attitudes are also supporting a whole new way of looking at places where they can actually use these types of tools and technologies, and where they go to actually activate their interest in this new healthy living. So one of those places is the gym. The gym is becoming the clinic. Gyms are starting to bring in a whole new way of offering services to consumers that go beyond just the fitness equipment and lifting and yoga and other things. They're starting to offer personalized paths based on your medical history, be able to gauge you, again, starting with testing, but then also offering clinical services, giving medical advice, offering these personal paths, and setting health goals, and then measuring your outcomes on an ongoing basis. Many of them have complementary apps and so forth that are measuring your progress so that you can see how you're progressing on your health goals. And under one roof, many of these are creating what they call concierge experiences. And those would be the scans, these would be consults, these would be even mental health, nutrition, offering a whole variety of consultative services to their membership, to their subscription membership. Some of the people leading the charge on this are familiar names, Lifetime. They have a whole offering called Mora, which is bringing all of these concierge services to the forefront. Equinox is offering this as well and starting to add this to their memberships. And it's very expensive in many cases, but at the same time, they're getting that innovator class that is really interested in this and is first to the forefront. Med spa is another group of facilities that are popping up all over the country. And these include groups like Everbody and Skin Spirit, Skin Laundry. It's combining this idea, it's really getting into this anti-aging of combining medical treatment, if you will, dermatology, along with spa type services so that you can feel good, but also improve your cosmetic appearance as well. And these are starting to crop up everywhere and are coming into many markets around you. Longevity centers is a whole nother place where people are starting to express their interest in health. In 2024, funding for these longevity centers soared 220% to $8.6 billion. So these are centers where they're really focusing on these anti-aging therapies. Some of them very experimental. It can be controversial, especially to your medical people, I'm sure. But so some of it's controversial. But at the same time, they're offering these latest and greatest treatments that supposedly can prolong your life and prolong your health span. It also includes things like fitness, nutrition counseling, functional medicine. They have functional medicine doctors that are involved there. They have scans and they are offering MRIs and biomarker scanning and biomarker measurement. So all of this is really in line with trying to create a membership model for your opportunity to create greater longevity. Many of these are at the very high end. Some of these are going for $40,000 a year, $50,000 a year, and so they're at the unreachable level for the mass population. But we can certainly see this being something that would start to scale over the years. Some of the leaders in this are right now Remedy Place, The Well, and Love Life. And they're getting a lot of funding. They're getting a lot of attention. International markets and as well as domestic markets. These are coming to play. So longevity centers is definitely something to keep an eye on and to be aware of. And then we even see it in our everyday lives. We see this whole movement of the medical facilities or these wellness and health facilities coming into neighborhoods near you. So this is just near my home. So within a mile of my house, there is a strip center, and these were all of the different locations that are in that strip center, whether cryotherapy, hearing and dental, a longevity center of IVX and IV therapy, IV vitamin therapy, as well as a fitness facility of Orange Theory and medical weight loss, chiropractic. These are just in one little strip center just near my home. Here you see another version of that, which is a whole grouping of these types of medically related or health related, just in a strip center, again, a mile away from my home. So you're starting to see this whole idea of medtail taking place as more centers are seeing the demand and the traffic pattern for these types of facilities, and even virtual with Superpower being offering a virtual version of being able to do testing and monitor and then have a very powerful app that allows you to have this continuous activity with them. So what does this mean for you? Well, first of all, I think you have to realize that there's this whole health ecosystem that is emerging outside of the traditional healthcare model. And younger consumers, particularly, are looking for more advice and tools than current providers are comfortable offering. And that's just a reality. Your providers are really not comfortable in this realm. They don't like to talk about it, they want to refer it to some other specialist. And many of these emerging offerings are outside of the payer model. They may represent an opportunity, actually, as opposed to a competitive threat. So where will your system be? Where will your system be? Will you continue to be in Fix Me Care? Or are you going to start to embrace more of a holistic viewpoint of the consumer model? Will you be reactive or proactive? And can you evolve your experience to marry solid clinical care with more preventative health care, to be in alignment with where these consumers are looking and seeing and wanting to express themselves. Thank you very much. Appreciate it.